My name is Ed Beveridge. I'm a psychiatrist. I work for North London Foundation Trust and I manage our inpatient services in our northern divisions. We know that people with mental health conditions smoke quite a lot more than the general public. So, for example, people with what we term severe mental illness or SMI, that's diagnoses like a psychosis, schizophrenia or bipolar disorder, have a prevalence of up to 40% compared with 14% in the general population. So it's a really significant disparity, and it's one of a number of health inequities that affect this group. And it's really important because it's one of the main reasons that people with severe mental illness, as well as other kinds of mental health problem not within that specific group, die a lot younger than the general population, 15 to 20 years, according to some evidence. So it's a really big health problem that needs very specific and, in my view, quite urgent attention. Smoking is associated with a number of really serious and fatal long-term health problems in people with mental illness. For example, we know that people in England who are in contact with mental health services have higher rates of early death from respiratory illness, cancer and cardiovascular disease, and all of those can be linked with smoking. So stopping smoking could reduce the risk in all of those cases. We know that there are lots of other, perhaps not fatal, but very serious health conditions which cause a lot of suffering in this group. And I'm thinking of things like COPD, peripheral vascular disease. A lot of our most problematic health conditions are specifically linked with smoking and with early death in this population, alongside which there's the whole issue of people's money, because smoking is also something very expensive that unfortunately in a cost of living crisis is a really big factor or a really big stress for people who are living with a mental health condition as well. As mental health professionals, we have a huge number of things to do when we have contact with our patients, and people might well ask, why should I be doing smoking cessation as well? And I guess there are a couple of reasons for that. Firstly, it's incredibly important because it is one of the reasons many of our patients are dying much younger than they should. Secondly, we're often the people with the best relationships or the best access to patients with really severe mental health conditions. So whilst in general, it works for people to be signposted to a stop smoking service, for our patients, that's often not the case. And if we can provide some kind of stop smoking support or help people to link up with it, then we can probably get the best outcomes of all for people with mental health conditions. In London, we are quite fortunate to have a lot of different forms of stop smoking support available. Within our mental health trusts, there is always some leadership around smoking cessation. All our trusts should be smoke-free. How that's implemented is quite variable, but I think we're moving towards being fully smoke-free across all of our organisations in the very near future, and if not, we certainly should be. There is local authority commissioned stop smoking support, which is available to everybody. Some of that is tailored to people with mental illness, and there are some interesting collaborations in some boroughs between mental health trusts and the local authority stop smoking provider, and that can be really, really helpful in terms of getting to people who really struggle to engage with generic services. There are online solutions. There is an app that the London Tobacco Alliance has made available, which is another route for people who are good with digital or have good access to devices. That might be the best solution for them. And of course, people have access to generic stop smoking services through their GPs, their community pharmacies, and sometimes it's a matter of us as mental health professionals proactively linking people up with those parts of the system and really making sure that they can stick with it and giving them the encouragement to do so as they go along. Vaping is a really common topic for us to be thinking about, and increasingly people vape as an alternative to smoking. There's an additional, or rather separate, problem of young people taking up vaping who don't smoke, and that's not really something that we need to think about specifically in this group, although it's something that people might want to keep in mind. The evidence for vapes and e-cigarettes suggests that it is safe. There have been a couple of really well-performed comprehensive evidence reviews done in conjunction with what was Public Health England. So the state of the evidence at the moment is that vaping is safe. That evidence could change if more evidence about safety emerges, and advice would change according to that. But as things are at the moment, certainly vaping is a lot better for you than smoking because it does not carry many of the same health risks at all. Therefore, I would encourage people to talk to patients about vaping as an alternative, to think about how to do it safely, to think about where to get vapes and how to use them. And I think that's something that I would really encourage professionals to have in the range of things they discuss with their patients when it comes to smoking cessation. Within a mental health trust or organisation, I think there's a lot of scope for teams to work together or to work with the wider organisation to make sure that smoking cessation is embedded in our work. People will be aware of something called MEC, making every contact count. That's an example of an approach where every conversation with a patient could incorporate something around smoking cessation or other well-being related topics. And trusts will have leaders who specialise in physical health and smoking cessation, and teams can work actively with them, perhaps for general advice or training for their members to make sure that they know how to give very brief advice or know about prescribing for nicotine replacement and other medication. Or they could do particular quality improvement projects that suit the particular kind of population that they work with. So there are a number of things that can happen within a team, within an organisation. Beyond that, I think it's really important for different parts of the system to work together. So, for example, for local authority colleagues who commission stop smoking services to work alongside mental health organisations to think about what tailored solutions would really best serve patients living in our areas, rather, to make sure that they have as good an opportunity to access stop smoking support as anyone else. Promoting the health, physical and mental, of all of the patients we work with is a key part of what all of us do as health professionals, mental health in particular. And I think it has to be all of our business. So I guess my challenge to everyone is to think about how I can make sure the people that I look after have the best access to stop smoking support so that they can get the longer term benefits of quitting smoking as soon as we can make it happen.